I do want to. The essence of your grace is centered on my grace. Adum. Thank you for watching A Healthy Living with Nana. So today I have a fantastic lady with me, and she's going to educate us about something special. Something that every day we go through without even thinking about. But this lady is a nurse. She's a specialist nurse, and she's going to educate us about something. I'm not going to say it. I nearly said it. I'm not going to say it. So have a seat, relax, have a drink, and I'm going to introduce her shortly for you, and she is going to take us through a lot. I will introduce Mrs. Ophelia Roberts. Thank you so much for coming, Ophelia. Have a seat. Thank you so much, Ophelia, for coming to Healthy Living with Nana. I want you to introduce yourself to my viewers so they know who you are and what you do.
Thank you very much for having me, Sister Nana. My name is Ophelia Roberts. I work in the community as a nurse, and what we basically do in the community is looking after people in their own home, ensuring that they are keeping well and healthy, looking after various conditions, and making sure that even though seeing those different conditions, they do have a look after period, and advising them as much as we can to help them continue to live as God giving us the permission and the willingness to do so. So thank you very much, sister.
Thank you so much. So you are doing a lot of work in the community. Even now in this pandemic with the coronavirus, you are able to go to people's houses to look after them safely. So you make sure you protect yourself so you are safe, and they are also safe in our home.
Yes.
Very
absolutely.
good. Very good. Healthy Living with Nana is shown in so many countries on Jabin TV. So as there are some places that they will not have this opportunity for people to come and look after them in their homes. But here we are. You are working somewhere that you look after the people in their own homes, and they don't have to go to hospital to manage their chronic diseases.
Yes.
So they only go to hospital when it's needed, when it's urgent. Yeah?
Absolutely.
Thank you so much for everything. So introduce to us what you are going to talk about today. I am excited. I know what you are talking about. I'm excited. But my viewers don't know what you are going to talk about. So please, let us know what you are going to talk about
so
today.
Today, I would like to talk about a topic which is very dear to my heart. It's about how we can maintain or look after our wee or urine, if I may say.
Yeah, I was going to ask, what is wee?
Wee or urine.
Yes.
So
we is just a slang language.
Word, yes.
Okay.
Yes.
Where do you hear the word we? Because it's not in some places when you talk about we, it's something else.
Oh yes.
But here you are also talking about we, and it's for urine.
Yes.
So which place in the world will you hear that word? Is it everywhere?
Most places are, because as we are living in modern world, it's a slang word which is mostly being used for young people. The elderly do use it. Quite a lot of people are now getting familiar with the word we or
so
urine
when they hear we, they know it's urine, and they know it's pee. So how we are going to look after our urine?
Yes.
So we have to look after our urine. Not the whole body is there.
Yes.
We're not looking after the body now, but today the urine.
Yes.
Wow. Okay. So I'm not taking too much of your time. Take us through. So what are we looking after in our wee or urine?
Urine, usually the urine comes from a vessel called the kidney.
Yes.
And in that kidney, it comes out, it's produced from blood, and then it's been excremated or it's been processed into a waste product, and that waste product is the wee.
Is the wee. Good.
Or
good.
the pee or the urine.
So the water the body is getting rid of in our system filters through the kidney and comes out as our wee.
Perfect. You got it. You're well into the topic. Thank you.
Yes. Good. Yeah, so what do we do with our wee?
So what we need to do, we first of all need to look at our hygiene. So being healthy is not just about what we eat. It's not just about having exercises, but what we've got inside the body is we need to maintain it. We need to look after it. We need to manage it in order to have that 3 or 4 parts of the system that we can have to manage and be living healthy.
Right. So healthy living, this is how healthy living is with Naana comes in. So with us, it's not only about what you eat. Because some people, when they hear about healthy living, straight away, they think about eating. Some people even make a mistake of thinking about losing weight. But no, it's not only about that. But it's about a lot of things in our life.
The inner self.
The inner self. It's about our brain, our thinking, our mental health. It's about what we put in our body. It's about how we look after ourselves.
Absolutely.
So it's about even our social life.
Yes.
We all need to have a healthy living in all these areas. So I am so happy today you are here telling us about our way. So please let us continue.
So to talk about how our wee or our pee or our urine can have certain implications in our lives, we need to look about how we look after our hygiene means in terms of having to wash the parts of the body that actually forms the areas where we are passing the process of weeing or urinating. So we need to look at our sexual partners, ensuring that we are not changing sexual partners, that we stick into one session, and how we clean. The cleanliness is also part of it. So I will sort of demonstrate that cleaning, you clean from front down, you don't clean from back to the front, because bacteria from the back can enter into the part where it's not meant to be. Bacteria called E. coli can cause that, and therefore that's when urine infection comes about. So if we're cleaning the area well, ensuring that we're looking at ourselves socially in terms of meeting other partners and all that, we're taking care of them. For children purposes, if you're a mother and you have children, ensure that you are taking the nappy pads, clean their area, body parts well, ensuring that the area is nice and dry, and change it when it needs to. Don't leave it for so long that the bacteria from the wee or the urine plus the pad is contaminated, and then it affects the child. So anything to try to minimize or stop or prevent, we have to try and work on or exercise that.
Okay, so I want us to take it one after the other. Okay, I know you are passionate. You've got all the information there. But for the sake of our viewers, I want us to take it step by step so they can understand it properly. So we are talking about hygiene. Looking after our hygiene as part of looking after our wee, because the part that the wee is going to come from is our private parts. So women have their private parts and men have their private parts, and those are the reproductive system they use to pass the urine. So when you are washing, you have to make sure you are washing it in a way that you will not introduce some infection into your private parts. So we have our backside and we have our front. So when we wash, like let's take me for instance. I'm a woman, so if I am washing, I have to wash from my front to my back.
Yes.
I don't have to. Let's say I'm using a towel.
Yeah.
I don't have to use the towel, my back first, and then I use it my front first.
Yes.
Because the bacteria behind me, they are different bacteria. You mentioned E. coli.
Yes.
So we can have E. coli as part of our visit from our backside.
Yes. Physics,
and although
or poo.
Poo. So although we have washed, or when we go to the toilet, we clean our back.
Yes.
But we always have residues there.
Yes.
So if I am washing and I'm cleaning my back, and I use the towel. Let's say, for example, I'm using my towel. I use it on my back. I will have bacteria from my back. And then I use it in my front. And I will introduce these bacteria from my back to the front. And they are not friends.
No.
Those bacteria, they are not friends.
Absolutely.
They don't mix.
No.
But if you use the safe one to go to the back, it's fine.
Yes, it is.
Because the front one is
easy,
more
susceptible to getting the infection or the urine infection. Yeah.
But then going to the back is fine.
Yes.
You are not going to get anything in your urine.
No.
In the back.
Because the fecal organ is made up that it's not as open as the frontal organs. And obviously there is more prevention from there than having
the front affected.
Yes.
Okay? So that's how we're going to look after our private parts. To look after ourselves, to stop us having urinary tract infection, which is the UTI you are talking about. We need to look after our private parts. Because the water, the urine coming, the wee, is coming from inside. And the private part is there. That is where it's coming through. And we want to look after it so that we don't get any infections. We want to look after ourselves. So that is the hygiene part. And then now you are talking about sexual parts.
Yes.
So because we use our sexual private part to mate.
Yes.
To mate with our partners. Then we have to also wash
before and after.
You wash before and after.
Yes.
So in this day and age, partners comes in all sorts.
Yes.
So how do you deal with those ones? Is it the same or it does not matter?
As long as we are using our mental capacity that God has given us and exercising our mental rights and ensuring that whatever we do, because we have to put caution and safety in every aspect of our daily activities. And we need to know whom we are mating with.
Yes.
We need to know what they are like in their hygiene standards.
Yes.
We need to know how they are. We ourselves are also maintaining our hygiene standard.
So if the person don't like to bath, you can tell them, don't come near me if you are not bathing.
No, but you have to have a discussion, a conversation.
Yes.
As nurses, we have different way of conversing with our clients, our patients. So you have to have like that relationship.
Yeah.
If not, you can learn by converting because you know your partner already, or you come to know them already. So you know what makes them tick, and you know what makes them happy, and you know what you will say to them as a lady that will make them
or a man
change, or a man.
Because we have both men and women watching the program, and sometimes we can't say that because we are ladies, we will say men doesn't want to wash. No, it doesn't happen. Sometimes you can have some women that they will even wash, but the way we are saying it, they might not be able to wash it like that. And also, we nurses, we know how to communicate with other people, but we have a lot of people watching us that are not nurses. So then how do they do it? You have said that they have to know their partners. What made them tick? What made them upset? What made them cry? What made them happy? So we always want the best side, which is the cheerful part.
Yes.
Especially if you are going to mate, if you are going to have any sexual interaction, you have to do it with the happy mood.
Yes,
you can't do with crying and
moaning and feeling upset about it, because then it's not a good effective love relationship.
So you want it to be safe and happy for all of you. Good. So that way you have cleaned yourself. What do you do again? Now we clean, we check our partners. What's next?
And I think the other most important thing, if not at all, that we can take anything home, is to ensure that, because we work quite a lot of times, and sometimes we forget even to we forget that we need to wee or we need to urinate, and we keep the bladder so full or the wee sac so full that it becomes difficult. Then that's when the urine infection develop, or
the kidneys.
In the kidney,
or in the bladder. Is it the bladder part or the
bladder part?
The bladder part.
Yes.
So people that we are very experienced in this as nurses, because you can go a very long time without passing urine, or sometimes you feel like going, you are bursting, and your patient need you, so you stay and you pretend nothing is happening, and surely you want to go. So it is not good, and it can't be only nurses, people everywhere. Sometimes you will be doing something and you might think you are too busy to go, and you hold the urine and you wouldn't want to stop what you were doing. But then when the urine stays in the bladder for too long, it also becomes a problem
in the long run.
In the long run, not today, not tomorrow, but in the long run,
because it can lead into quite a lot of other complications with your kidney. There's quite a lot of people that are in hospital being dialyzed because they probably weren't obeying the rule of weeing or urinating when they need it all the time. So they ended up in such horrible circumstances. But by the God-given right, we still are alive. We need to look after every aspect. Every system in our body is equally important. But for today's topic, it's good to know that weeing is important, or urinating is very important. And some people always uses the word or the phrase, my body clock. So listen to your body clock. And when your body clock tells you to be, my sister, my brother, everybody out there, do it. Even if it's in an emergency, do it. Because you are keeping your life healthy, you are keeping alive, you are doing the right thing.
So not looking after our bladder or kidney is not good for us. We have to look after ourselves by weeing, emptying the bladder when it's necessary. Listen to your body clock.
Yes.
So the body clock tells you you have to go, you have to go. Whatever you were doing, excuse people, stop what you are doing and go. What else can we do? Now we have listened to our body clock. What else do we need to do?
What else we need to do? We can maintain a healthy lifestyle. So we can, even if we can demonstrate drinking something simple and common, which is so beautiful and nice and clear, like water is a very ideal way of keeping ourselves hydrated, getting rid of any bacteria built in our system, which can then be excreted or go through the urinary system to be able to, for us, when we are empty any bacteria built in our system.
We are cleansing our system.
So as an example, we like to demonstrate that we are drinking and we are helping ourselves. Cheers, sister.
Very nice, so refreshing. So we find it difficult most of the time to drink water, but water is very necessary for mankind. Water is very necessary. It does a lot for the body. Although we don't like all the time to drink it, it is very, very important. So now our sister Ophelia has taught us how water can help our kidneys, how it can wash out all the sediments from our system and come out in our wee. And we are going to look after ourselves by going to wee when the body clock says, hey, it's time to go. You run and you do it. So how much water will you say somebody have to drink to say that I am looking after my wee? How much water do you need?
It's based on individual workload or based on individuals' activities of daily living. And we have people or some people that may not even are not mobile or difficulty getting to the water.
Yes.
We can help them by bringing the water to them. And we can also encourage. So it's more about encouragement, and everything is the mindset.
Yeah.
Once we set our mindset that we are going to drink, say, a liter of water a day, we are doing the beautiful job of ensuring that we are maintaining hydration, and it helps us to lose weight because we're taking out whatever is there that we do not need in our body.
All right. So if you are somewhere with somebody, you are home with old person, or even if the person is not old and they are not mobile, you have to help them by giving them some water every time. Make sure they are close to water, that they can just reach even if nobody is there. If you are a child, you are home and you are with your parents, please, when they need water, run and give them water. Parents, make sure the children have been drinking all the time, because children don't like to drink. It's not only adults. They rather have the drinks.
The
sweet drinks. The fizzy drinks. If they have those ones, then they are happy. But then those ones are very acidic. And it's the acid
that
in
causes
the drink
sediments,
that is going to cause the sediment in the body. So anything that is alkaline is easy excreted. That one is good.
Perfect.
But acidic ones, they are bad. Healthy Living with Nana, we are talking about urine today. And we want to know. We don't want to go to the technicalities of what make up we and all that, because that one is in the body. What we want to know is how to look after ourselves. What we need to do when it's time to wee. So keep watching Healthy Living with Nana. So thank you, sister. What else do you want us to know about the urine?
As you're talking about healthy living, it's also important to recognize fruits. So an example which I personally like is cranberry juice.
Cranberry juice is very good.
It's very good. It helps. And because of possible maybe manufacturer issues and all that, we need to ensure that if we feel that it's too sweet, we can dilute it with water. It's still the same taste, and it will it's still the same thing, and it will help us as well to build our immunity.
So people will want to know that, we are looking after ourselves. I say water is Healthy Living with Nana. So we always try to educate people on things they can eat as well. So every time we come on the screen, we want to show people. So today we're talking about wee. We're talking about how to look after ourselves. So we are going to show people what cranberry juice is and other things that they can also have to have a healthy living. So if you want to stop yourself having infections, you need to eat well. And by having things in their right order. So we will come to that one in the next session. We will show how they can also look after themselves or ourselves by eating healthily. That part.
I'm looking forward to that. And I'm sure our viewers are looking forward to that.
Definitely. So how will somebody know that they have got urine infection? So we're talking about urine. They will say looking after your body. Everybody will say, I'm looking after my body. When I want to wee, I go and wee. But now we are saying there is an infection called urinary tract infection or UTI. So how will somebody know they have got UTI?
There's quite a lot of different ways or symptoms or signs that can be identified through the body. So you can't get a temperature. If your temperature is above 36 and above, or say 38, you definitely, and you are shivering, and you get cold as well, then you definitely have the symptoms. Or if you have pain in your tummy, below your rib area, or even to the back, you have urinary tract infection of that nature. And also burning sensation, or the frequency going to the toilet so many times to wee. Those are simple, common things that can tell anyone and everybody that something is not right here, and therefore you need to get help.
Okay, so you have burning sensation when you are passing water. When you are weeing, it's burning. You have lower abdominal pains. You can have back pains, frequently, every minute you want to wee. When you go, it's just a little wee, and you come back. And at 2 seconds later, you want to wee again, and you go. Now we are telling people not to hold. So they said, don't hold, go. And then I'm here, 2 minutes I go, and I come back, and another minute I have to go again. Then I have to say, what's happening?
Yes.
I think I'm looking after myself by going, but then I'm going too many times.
Yes.
So I need to seek help.
Yes.
I need to go to the hospital. So today we're talking about wee. We're talking about how to look after ourselves. So we are going to show, people what cranberry juices and other things that they can also have to have a healthy living.
Yes.
So if you want to stop yourself having infections, you need to eat well.
Yes.
And by having things in their right order. So we will come to that one in the next session. We will show how they can also look after themselves or ourselves by eating healthily.
Yes.
That part.
Oh, I'm looking forward to that. And
Yes.
I'm sure our
It's
viewers are looking forward to that.
Definitely. How will somebody know that they have got urine infection?
Okay.
So we're talking about urine. They will say looking after your body. Okay, everybody will say, I'm looking after my body. When I want to wee, I go and wee. But now we are saying there is an infection called urinary tract infection or UTI. So how will somebody know they have got UTI?
Yes, there's quite a lot of different ways or symptoms or signs that can be identified through the body. So you can't get a temperature. If your temperature is above 36 and above, or say 38, you definitely, and you are shivering, and you get cold as well, then you definitely have the symptoms. Or if you have pain in your tummy, below your rib area, or even to the back, you have urinary tract infection of that nature. And also burning sensation, or the frequency going to the toilet so many times to wee. Those are simple, common things that can tell anyone and everybody that something is not right here, and therefore you need to get help.
Okay, so you have burning sensation when you are passing water. When you are weeing, it's burning. You have lower abdominal pains. You can have back pains, frequently, every minute you want to wee. When you go, it's just a little wee, and you come back. And at 2 seconds later, you want to wee again, and you go. Now we are telling people not to hold. So they said, don't hold, go. And then I'm here, 2 minutes I go, and I come back, and another minute I have to go again. Then I have to say, what's happening?
Yes.
I think I'm looking after myself by going, but then I'm going too many times.
Yes.
So I need to seek help.
Yes.
I need to go to the hospital. If you are somewhere, you are lucky to have a general practitioner with GPs, you go to your GP and you let them know. If you are somewhere, you have a private doctor, you see the doctor about it, because it's something that you don't have to ignore. It's important that you treat it.
Yes.
What will happen if you don't treat it? Because if I go wee several times, if I'm having the burning sensation weeing and I don't mind, it's fine, isn't it?
No,
It's
not.
So what will happen?
What would happen? The complications of it is that you would then have the infection build up, which can lead you into being in hospital for a long period of time and be put on IV intravenous antibiotics. Or if we catch it in early stages, it can be treated either by self-care, which self-care in terms of treatment could be you can get paracetamol to try to help with the pain, and to reduce the temperature. And also drinking water. And if the urine or the infection lasts for 2 or more days, definitely you need a doctor or a nurse. If the nurse, you have someone near you who is a nurse, they can look into the reasons why you are feeling the way you feel, and they can advise you to seek for further help or go to see hospital to be checked properly.
Okay, so you have gotten all the symptoms, and you now go to your hospital, or you see your doctor or your nurse. Like you're saying, you have a nurse close by, you see a nurse, and the nurse say, okay, I think so. How do they diagnose it? Is this just because you are saying you it's burning, or you are going frequent, then they will say, oh, you got UTI? How would they know it's UTI?
From your own home, you can tell that it is urine infection, because the color of the urine will be cloudy and dark, and it will be smelly. It will smell more than the usual smelling of wee. Usually, when your urine hasn't got any infection in it, you wouldn't smell.
You know your wee.
Yes,
you know your wee.
Yes.
So you see a change in the wee. And then now it's smelling. The color has changed.
Yes.
It has turned foamy.
Yes.
Then you are like, what is happening?
Yes.
I think I
need help.
I need help.
Yes.
So that is very important. Check your urine.
Yes.
It's not just going to the toilet. Check it after doing it. Yes. Check to see if everything is right. Yes. Especially when you start having those symptoms that we've talked about. Yes. So you can go and say, okay, my wee is also like this. Is there any other test?
And some people can have blood in the urine, which can be equally very serious.
So how do you know you have blood?
Kidney infection. It could lead into quite a lot of complicated early or late stage of either a kidney disease or stones or other contributory factors, which is equally dangerous, and we need to watch out for that.
Good.
And especially women, menopausal ages as well. We need to look after ourselves.
Okay, so women of a certain age also have to, because they become prone to having the UTIs. Yes. So they have to look after themselves more. Yes. Right. So we are now going to look after ourselves. Check the wee anytime we pass the urine. You look at the color. You look at the smell. Is it smelling funny? Is that the way my wee always smell? If you have seen that there is a change, you go to the hospital. What tests are they going to do to make sure it's this and not that? Okay.
Usually it depends on where you are. Samples of your urine is being taken. So a doctor or a nurse or a health professional or anyone medically inclined would advise you need to get a sample. Say for instance, the ladies, when you are having a baby, for them to test that you are confirmed pregnant, they get a sample of your wee and they are able to confirm. Same way that a sample of your, not the same technical way it's done, but a sample of your urine is being
so taken. You need a urine test. You need the urine test to be able to confirm whether it's UTI. Yes. Okay. So you've done it. You do the urine test. So when you go, the doctor will ask you to bring your urine. So when you are going, is it advisable? Going now, I'm having all this burning when I'm urinating. I've seen these signs in my urine that it's cloudy, the color have changed, it's smelly. When I'm going to the hospital, should I be prepared and go with my urine, or I should just wait? When I go, they will tell me what to do. What do I do?
Usually in a hospital settings, once you approach the healthcare professional or a nurse or someone working in that medical field, what they will do, they will give you a sample, a bottle for you to produce the urine, and then they will go and test it, which is called dipstick. The dipstick will come up in a strip, and it will tell you what is nitrate, what is leukocyte, what is blood, and what is positive dip. So the result of it will confirm. If it's positive, then you definitely have a urine infection. If it's negative or not applicable, or it doesn't show you have any of these symptoms, then you probably will need further investigation as to why you are having all the symptoms of the shivering, the weeping, and all that, because it may be also more concerning, more worsening condition that has to be looked at.
So the first thing is your dipstick. They will do the dipstick, and that will show them different components in the urine. So the urine, there's a lot of things that comes out to form the urine. It's not just water. Okay, so they will dip it and see that you have this and this and that. If you do not have anything in there, it will show nothing. Everything there is because correct. You can see your glucose there. You talk about blood, you talk about leukocytes, you talk about nitrates. So all and even the pH of the urine is there. So all the components there is marked on the bottle. So they will match it. If all the levels are negative, they know it's negative. But if any level is high, then they know you have got that infection.
And
so
then
you need your treatment. How are they going to treat it?
Okay, so first of all, they will look into many ways, or 2 ways. Either you have an antibiotic. The first advice I would say is they will also ask you to take painkillers to help with the pain. They will also ask you to drink plenty of fluids. They will give you the first initial advice, the basis of you looking after your wee in the first place, so that you get into an understanding of it. And then they will also then decide, depending on the level or the severity of your infection level, then they will decide, okay, we will give you an antibiotic, which is something you can take in the mouth. Or if it's very severe, then you need a drip, an IV antibiotic, and it will take, and you might be hospitalized for so many days until. And they also do blood tests to confirm that yes, the infection is that serious that we need to keep you in hospital to look after you, and after or before you are discharged, they'll give you a further health advice to look after yourself and look after your wee.
So it's a law. It's a law when the UTI starts. So it's something that can be treated quickly at home. By the doctor giving you simple antibiotics. You take for many days and you are okay. And it won't come again if you look after yourself. But then it can be serious that you will be hospitalized. And because once they realize you need IV, which is intravenous antibiotics, which goes directly to the blood to work quickly and more effectively, then you need to be in hospital because you can't be at home and they give you that. So in many places you will need to be in hospital to get the IV antibiotic for that treatment. And that is when, if you are somewhere that you don't have a free healthcare system, it becomes very
cost effective.
It becomes expensive.
It is.
But then if you are somewhere that you have the free healthcare system, is a little bit better. But the people watching us in so many places might be in places that they will need to pay for their healthcare, and then it becomes very expensive for them. So what kind of antibiotics would they need?
Usually,
we don't want people going to buy things themselves to say, oh, I have got UTI, let me just go and buy this. We don't want that. But just to give people an idea that, okay, if I'm in hospital and they give me this, I will know that, oh, it's fine.
Yes.
It's fine because it's for UTI. Or it can be any antibiotic.
No.
It's not any antibiotics.
No. There's quite a lot of, the market out there has brought widespread or wide spectrum of antibiotics that we can use to treat UTI or urinary tract infection, and that is looking after our wee or pee or urine.
So that is the first point,
and that
to
is
look after yourself to prevent you having it.
Yes.
But then when you have it,
the treatments are, for antibiotic, we have amoxicillin.
Okay.
We have a drug called nitrofurantoin. We have a drug called trimethoprim. And these are based on individual conditions.
Yes.
Or there's conditions that you present yourself to the doctor about.
The level you have reached in because it's not just saying, okay, I have got UTI. Because my urine is smelling, or because I'm going too many times, so I'm just, because there are some places here you cannot go to the chemist and buy antibiotics, but there are some places people can just walk into chemist to buy antibiotics. So the idea is for people not to just go and buy, but then for them to seek professional help. To know exactly what is wrong with them, to be able to know what they need to treat that particular UTI. Because the level of the UTI is very important.
It is.
If it is in the initial stage, it's simple. You can just use some antibiotics, oral antibiotics, which
or
will
painkillers.
Or painkillers is gone. But then, if you have reached a stage that you need the IV, it will be different. Or even sometimes it's still the oral, but then you need a stronger antibiotic to be able to, or combination of antibiotics. So it is always important to go and seek professional help. Very, very important. When you are home, you look after yourself, and so that you don't get it. That is the preventative method. You prevent. Once you are not able to prevent and you get it, you need to seek professional help. Don't stay at home and treat yourself. That is not going to work. No self-treatment. Because you need the proper diagnosis and proper treatment.
And you also have to be aware that you are not allergic to perhaps amoxicillin, because I know some areas amoxicillin is number one antibiotic that they tend to go for most things. You can use antibiotic to treat wound infection. You can also use it to treat chest infection. You can use it to treat urine infection. But you have to be careful that you are not going to react to the antibiotic, which will cause you more severe condition, which will end up in hospital. So you need to be careful. You need to know your medical condition. You need to know yourself.
That is very, very important. That is why it's important not to self-medicate at home, especially when it comes to antibiotics. Because some people are allergic to it, and some people are even allergic to more than one antibiotic. So you don't want to say, I have watched Healthy Living with Nana, and our sister was talking about using this kind of treatment, so I'm going to use it. No, that is a no-no. That is not looking after yourself. Looking after yourself is seeking after professional help, so that they will diagnose what is wrong and they will give you the correct treatment. It is very important that you have the correct treatment, the right medication, the right dose, the right time of taking it, and the right course. Because every time, some people, some antibiotics, they will say take 5 days. Some they will say take 7 days. Some they will say take 10 days. So that is the correct way of doing it. And only the professional will be able to tell you that. Not just because you have bought it, you are okay. You are not okay. Please seek professional help so that they will give you the right treatment. What next do you want us to say?
And lastly, just to let our viewers know that taking antibiotic is good, but you have to also watch out that those antibiotics you are taking isn't going to cause any side effect of your normal medications that you are taking. Because if it's going to interfere or cause any other effect of your normal medication, which you are being put on as a treatment, you need to also seek further help. So seek help when you are on the medication, and seek help when you know this may have another problem or complication to what I'm taking already.
Thank you. Thank you so much, because that is very crucial. That is very crucial. Some people are already on medication treating their other conditions.
Yes.
So that is even the most important thing. If you are on any medication, before you take another one, you should be able to tell, is this going to interact with my other medication? And you will not be able to know. That is why it is always important to seek medical help from a professional. The doctors will know. They will look. They are your doctors. You always see them. They know, or even if they are not, they know the history. Even if they are not, they don't know you. They ask you, what kind of medication do you take?
Yes.
What other illnesses do you have?
Yes.
So they will take all that history, which will help them to prescribe the right antibiotic for you.
Yes.
So it's not just about having the antibiotics.
No.
There's more
to it
than that.
Yes.
So your health condition, your other health condition, they will know.
Yes.
They have to know of other medications you are taking.
Yes.
They have to know about your allergies before prescribing.
Yes. Yes.
So all that information will be taken from you to be able to give you the right treatment for UTI. But the right treatment for UTI is
look after
your wee. Thank you
very much.
Thank you so much, Sister Ophelia, for coming. You have helped us to now know how we are going to look after our wee.
Yes.
From now, all viewers know wee is very important. Just a quick recap. Go when it's time to go. Don't waste time. When you see signs that are wrong, seek help. Do not self-medicate. Seek professional help. And look after your wee. Thank you so much. And the most important, water.
Yes.
Drink plenty of water, and that water will help you to stay healthy and look after your wee. Because one thing that, sister, I can say is, sometimes when you go for a long time, we nurses, we know that you hold it for a long time. But then you go and you look back and you're like, oh, I haven't had water today. You haven't had any pain, but just by looking at that, you know you have not been having water.
Oh, absolutely.
So you go and you go for a quick break, you have a glass of water or two, and then later you go again, because once you drink, you have to go.
And you can see the changes in the
difference.
Yes.
So it is very important. Whoever wants to try it, if you have not been doing this, please do it. You go and you wee when you are very dry, knowing you have not taken enough water for the day. So you do and you look. But then you go back, drink lots of water because you don't like the color. So I think that is actually the first treatment.
Yes, absolutely.
That is the first treatment.
Because that will put a mark on our mind.
Yes, as soon as you see there is a change in the wee, just trust it to yourself by drinking water.
Yes, I like
lots
that.
And lots lots and lots of water. And you see that the moment you start drinking, you will start going. And you straight away you will see the change
and
the purification. The purification of the kidney, because the water will purify everything, and the color will start changing. So if you are lucky, you will not even get to the hospital, because before you know, you are sorted at home with water because
Yes.
our time is out.
Yes.
So thank you so much, Sister
It's
Ophelia,
It's a
for
pleasure.
coming. I have this here for you.
Oh.
Very nice present from Healthy Living with Nana. We say thank you, sister, for coming. We haven't finished. There is the bit that we are going to talk about food.
Ooh, I'm looking forward.
We will give you this and say thank you for coming.
Thank you.
And
Thank
we'll
you very
see you
much.
again after the break, and we'll talk about what we can eat to help ourselves.
Wow, I'm
Thank
really
you.
looking forward, viewers. Exciting moment to come. Thank you so much, Nana,
you.
for having me. God bless.
Okay. Welcome back, sister, to Healthy Living with Nana's Kitchen. This is the part that we talk about the food. Because we said our body, we have to look at it as a whole person. Physically, mentally, emotionally, spiritually. Okay? So to look after our spiritual being, our physical body, today you have taught us about our we. How we need to look after our we. So if we are looking after our we, it means we have to look after the body.
Yes.
Because the body will be able to get all that it needs, all the nutrients the body needs, for the body to be able to produce a good we.
Yes.
And that is the urine. That is why you told us to take lots of water. Okay? So today I am going to show everything here.
Perfect.
What we are going to get out of it.
Wow.
And how it can help the body. So what we have here today, I will open this, and those from our part of the country can see that this is banku.
Woo!
We call it banku. Okay? If you are somewhere that you are not used to banku, banku is simply made from corn, cassava dough and corn dough. So the corn and the cassava dough we mix and we use it to make the banku. That is our source of carbohydrate. And this carbohydrate, when we eat it, is going to turn into sugars in our body. The glucose and the fructose that we'll get out of the carbohydrate, they are sugars. So we don't want to add extra sugar. This food is savory. Okay? We have here peppers. Peppers have got lots of vitamins in it. Lots of vitamin C in peppers. Okay, that is why I'm going to add peppers to the food. Fish is a very good source of protein. For the kidney, some people actually, their doctors will tell them because of their kidney issues, they don't have to eat meat. Because the meat have got...
Because it's red meat
particularly. You see? They will tell them not to eat red meat. But they will always tell you to eat fish. Or white meat. Now we have here, this is tomato.
Wow.
As a garnish. Very nice. So what can we get from tomato, Auntie Ophelia?
We get a lot of vitamin C.
Vitamin C from tomato.
We get a lot of other vitamins, which is very important. And it's also good for the skin.
For the skin
and the hair.
And the hair. Not just our we.
No.
So tomato is going to help our skin. We also have antioxidants in tomato. Which is very good for us
to maintain our
immune system. Now we have here onions. I have actually chopped them up so that we use it direct instead of chopping it today, because today, for time's sake, we are talking about the food, not how to prepare it, but what we get out of the food. So onion is a very good source of vitamins. Antioxidant, we will get antioxidants from onions. Anti-inflammatory from onions. And this is going to stop us fight infections. And then we have tomato here. So this tomato is for garnishing. This tomato is also for garnishing. But we have different kinds of tomato.
Yes.
We have cherry tomato, and we have the big tomato, that salad tomato, some people will call that. We have actually just chop it up. Okay, everybody know how to chop it.
Yeah.
So we are going to put all this in combination. Okay, I have salsa here. This salsa I have prepared using tomato, onions, pepper, pinch of salt. Okay, these are the things I have used, and all that I have done is to blend it, blend all of it together to form the salsa. So you put pepper depending on how hot you want it.
Yeah.
If you want it mild, you put just a tiny bit of chili pepper. If you want it extra hot, like some people like it, from my part of country, they like extra hot.
Yes.
You put lots of pepper to make it extra hot. But if you are somewhere that you don't like pepper, you don't like spicy food, you just put tiny pepper in just to have the kick of the pepper. That's all. Okay?
And also the salt, you have to be careful because
with salt
can affect your kidney.
Salt can
so
affect
you
the
need
kidney.
to minimize the amount of salt intake. If you're having salt, please do not add Maggi cube because it equally got salt.
That's the benefit of having this food. This food does not have any extra
spices.
No spices at all.
And that's what I like, because we are trying to be healthy, but maintaining minimize what we are adding in to avoid infections. And all this will help us to prevent the infections, and we can live a healthy normal lifestyle.
Okay, we have actually washed our hands so we can touch the food. We have washed our hands. Washing of hands is very important. So I'm touching this banku.
Oh, it looks very
small proportion. Okay,
exciting moment.
Exciting moment for everyone. Okay, so I'll take just one banku. So I'm just going to demonstrate. Unwrap it. I just put the plastic there just to help it to keep the heat and not to dry out. Sister Ophelia, you want to serve some of it?
Oh, this is looking nice.
Yeah.
Okay, I'm not sure where to start.
Yeah.
Okay,
anyway,
so I'll take the salsa.
Yeah, take the salsa. I'll bring this fish from here to here. Yeah. Put this side on the side.
Then I think I will take some tomatoes.
Beautiful. Apart from that, you want to get all the nutrients. Okay, so I'll bring some of the small fish. Okay. So we want lots of fish on it. Yeah, we want lots because the banku is carbohydrate. The carbohydrate, as I said earlier on, is going to give us sugars. So we want to complement it with all the other nutrients. So it's done now.
Ooh, looks really nice.
Very
exciting
beautiful
moment.
Yeah,
everyone.
Yeah,
it's nice and soft and
nice
smooth.
And soft, yes.
And you take the portion.
Yeah. That you need,
you put it on there.
Yeah.
I'll start with
you dip it in the salsa.
You put on the salsa or the sauce.
Yeah.
Yummy. Very nice.
Yeah, very beautiful.
The next wonderful fish, which is no oil, less oil. Yeah. Really good and tasty.
Very tasty.
Nice and crunchy.
Yeah.
And the salt is beautiful. Right taste.
Beautiful.
I'll try the pepper. And I'll do my onion last because I like to have the taste of the onion in my mouth.
Right. Beautiful.
Very nice.
Very nice. Good.
Come on, everybody. I'm sure your mouth is watering already.
Even me standing here, my mouth is watering. Thank you so much for watching Healthy Living with Nana. I hope you have learned a lot today. Tell a friend to tell a friend that they should follow us. You want to say something to our viewers? Yeah.
Well, everyone and viewers, it's been really exciting time to join our wonderful sister Nana. Please continue watching her great, wonderful program. It's really healthy and we're learning a lot. I have learned a lot myself. and I'm sure to put it into practice. And it's been a great privilege to see the great work she's doing. Please continue to support her, because I definitely will be doing it from now on. Thank you, sister, for having me.
Thank you.
And enjoying this
coming.
wonderful
Thank
meal.
you.
God bless.
Thank you. See you later. Bye.
Bye.